Erin. Okay, so I'm going to talk a little bit now that, Erin has given that nice overview of what nerves are, what the brachial plexus are. I was going to talk a little bit about what happens in a brachial plexus birth injury. So if you want to go forward, the slide. So we're
You
going
want
to, yes, yeah, it's okay. So that's a good video that Erin has put in there demonstrating a baby where you can see that the left arm is moving all around as the baby's kicking, but the right arm is not. But the hand is and the fingers are clenching, and so there's some movement there. So, when we are seeing and evaluating babies in clinic, we all go through the history of the birth and then examine the baby. And those two things are really important for us to make the diagnosis because there's a very often classic history of the birth and some known risk factors, and then the appearance of the arm at birth. And then how it's kind of recovered over time are all very important factors that help us to determine that a child has a brachial plexus birth injury. And we look at the entire arm from the shoulder down to the elbow to the wrist and hand. And we do this ourselves, but often we do this as part of a larger team with our therapist so that multiple people are evaluating the baby. Okay, so